Why till the first couple of days after the procedure, obviously you're gonna feel like you've had surgery, and you did. So I tell patients, don't try to rush yourself through it because you are healing and it does take time. A tummy tuck is when we take out excessive skin, and that's what everybody knows out there, but the form of terminology is abdominoplasty, removing excessive skin. A mini tummy tuck is when the loose skin is really around the length of a C-section. So most women, if they've had a C-section or they gain a little weight, they have this little push and a small skin, not very much. So when I do a mini tummy tuck, the incision is no wider than, if you look at your breast line, no wider than that. So that's what we call a mini tummy tuck. A full tummy tuck is when the scar incision goes a little further out. In that case, most of the time it's pulling the skin down, and we may just leave the belly button or we may have to reposition it. An extended tummy tuck is for the woman that really has a lot of excessive skin and it goes even far beyond the sides, so we have to go a little bit behind. So that's what I'll call the extended tummy tuck, and the skin is just more excessive. And in that case, I always reposition the belly button. That's such a great question. The answer is it depends where your stretch mark is. Some women's stretch mark is very limited below the belly button and very small. Yes, in that case, if I do a tummy tuck, the stretch mark is going to be gone. But if you have stretch mark all over your abdomen, upper and lower abdomen, it's going to improve how much stretch mark you have after the procedure, but it's not going to take all of it away because the stretch mark was just so much and went all the way up even to the side. Yes, and yes, you should. And you really want to wear it. I tell my patients 4 to 8 weeks. The longer the better. It really helps your recovery. It just helps with controlling how things are going to form. It also helps with pain, actually, and it helps with your posture. So I think wearing the compression garment is an important part of how the results is going to look. Yes, I really take into effect when I'm doing my tummy tuck the woman's body habitus. I look at the structure and I see what's the best way to do a tummy tuck and also give her an appearance where if she's wearing her swimsuit, it doesn't show. So I really try to follow those natural curves where I know the swimsuit line is going to be, and we talk it over, we look at the mirror, we discuss it together, and then I make the scars and incision along those lines so that she's happy with the results and I'm happy too. The style of tummy tuck that I do and my technique, my patients don't need a surgical drain. So no, in my hands and in my procedure with the tummy tuck, you do not need a drain, and it's so helpful for the woman, and the recovery is great because you don't have to worry about all that fluid coming out. Again, it goes back to the surgical technique and how the tumescent fluid is injected and how I do the removal of the fluid so I don't have to put a drain to you. No sooner than 4 weeks. The first 4 weeks, I do want you to walk around, several times a day is really good for you, it's good for your recovery. But hardcore going to the gym, doing all that stuff, no sooner than 4 weeks, because you just need to give your body time to heal. Once the healing is done, then you can gradually go back into working out and doing the things that you love to do. I say a safe number is 8 weeks. Everyone's pre-surgical physical physique determines how sooner you go back. Now, if you never was a person that was big on working out or exercising much, obviously going back sooner into strenuous activity is not going to be for you. But someone that was like big on it and was doing all those things before tummy tuck, you can go back a lot sooner. 4 weeks, maybe 5 weeks, maybe 3 weeks. It's really customizable. There's not a one-size-fits-all with that. It's a very simple thing I tell patients or tell anyone. What do you want? When you look yourself in the mirror, do you say, oh, I have this loose skin and I would just like for it to go away, or I want to look better, or what is it that you want? So during that cosmetic consultation, I really get to involve myself in the client's journey and talk to them and see, and basically ask them, what is it that you want? Once I know what you want, then I can say, okay, yes, tummy tuck is for you, or no, it's not for you. Or you have great skin, if we just do amazing lipo, you can get the results that you need. You don't need to have a tummy tuck. So it really starts with, what do you want? Can a tummy tuck be performed in any other procedure? The answer is yes. It can be performed with facial procedures, it can be performed with breast procedures, it can be performed with feminine aesthetic procedures. So yes, I combine it with a lot of other procedures, and it all depends on what the patient wants. During that discussion, we talk about some of the wants on the list, and we can combine it or we leave it alone. So the recovery time for a tummy tuck, the first 2 weeks, well, actually the first couple of days after the procedure, obviously you're gonna feel like you've had surgery, and you did. So I tell patients, don't try to rush yourself through it because you are healing and it does take time. The most important thing I want for my patient is to eat well, eat healthy, and be mobile. Even if it's just walking around the house or walking in the backyard, doing some light walking is really good, that first 1 to 2 weeks. After that, you can really get back to most of what you're already doing. Driving is okay, and you're still healing, but you'll be feeling great. Usually by 4 weeks or so, you should really be back to your everyday activity, and then infusing working out as the time goes by.